This is a show about the diversity of academic and experiential backgrounds of people working in patient safety. My name is Ivan. I am a lab rat turned infection preventionist. While struggling to find work, I reached out to a friend for support. Our chat turned into a LinkedIn post that showed me that many people in our field were in the same situation. The purpose of the Safety Spectrum podcast is to celebrate credential, educational, and experiential diversity, to share the values and success stories of non-traditional staff in quality patient safety and infection prevention, to advocate for competency-based versus credential-limited hiring, and to increase awareness of the importance of the infection preventionist and other roles in the healthcare safety sector.
Carmen Duke is an epidemiologist with an MPH and 9 years of healthcare experience. She graduated from Georgia Southern University. Her career started in adhesives and her IP career started in Alaska. I will let her share more on that. Welcome to the Safety Spectrum podcast.
Carmen, welcome to the show. How are you doing today?
I'm doing well. Thanks, Ivan. I'm excited to be here with you today.
Absolutely. So Carmen and I got to share a little bit of an adventure at the APIC conference, and what was it? The PDI event.
Yes.
Yes, and I learned there that you are a karaoke queen, and
I do enjoy singing along. I don't enjoy being the main voice.
Okay. All right. So you're not going to be up on stage, but you will belt it out with the audience.
Yes.
That's great.
Yeah, that's what I must be.
It's always interesting to see IPs off the job, you know, like who we are when we are off the clock and dressed down, just like, oh, right. I just always find that interesting. Anyway, let's get into the show. So, Carmen, describe for us your career progression. How did you get to where you are?
Okay. Well, that path has some twists and turns for sure. I can't say that I knew what infection prevention was while I was in high school or even in college. My somewhat original plan was to go to dental school and become a dentist. So that led me to, once I made that decision, I changed my major to chemistry while I was at Georgia Southern. I had originally gone there to be a dietitian, which is kind of what put me at that school to begin with. So after a few dental school rejections, a professor recommended getting a master's of public health. That was really the first time I'd heard of that particular field. At the time, I decided I would just work in chemistry and keep applying to dental school. So I actually made adhesives for a little bit, which, as an IP, we absolutely hate adhesives of any kind. So that's kind of funny. And then after a few more years of rejections, I really started taking that MPH more seriously. I really started to love the idea of epidemiology specifically. And so I went down that path of getting an MPH.
Okay. I wanted to be a dentist, but I decided I couldn't afford it. So I gave up and went to become a lab rat instead. And so, it's curious where I would have ended up, because lab led to infection prevention. So, do you recall if there was something specific that kind of clicked during your MPH training that made you that inspired that interest in epidemiology? Was there a particular course, a particular class, or it was just something that happened over time?
I had one professor. I ended up doing a graduate assistantship was him, who was just so passionate about epidemiology. And I really saw it as a way to really affect, the health of a whole population. And I just thought that was so neat, that how all of the research done can impact policy, can impact practices. And I just enjoyed it. I felt like it was really fun collecting that data, analyzing that data, and then seeing how we could improve health of a society, a population, the town, however you wanted to apply it.
Okay. So how did you get from adhesives to infection prevention?
So as I neared my MPH graduation date, my spouse received orders to Fairbanks, Alaska. So to be honest, I was really applying for anything remotely related to public health. It's not a very large city and no large city nearby. And so I was really just, looking to see what was out there. And the local hospital was hiring for an infection preventionist. And it was friendly to backgrounds other than nursing. And at the time, I didn't realize how rare that was. But I applied, I got the interview, which was actually the entire C-suite was in on that interview, the first round interview. But ultimately got offered the position. And honestly, it was really a dream entry into infection prevention. My boss was amazing. I was taking the place of an infection preventionist that was retiring, and she had actually started the program and stayed on to train me. And she was just a wealth of knowledge. And then on top of that, within my first week, I got to be a part of a measles workup, contact tracing. So I was hooked.
You just went into the deep end, didn't you?
Yes, yes.
Oh, wow. Were there any measles, secondary cases?
No, a staff member and their child had gotten measles during international travel, but thankfully it didn't spread to anyone else in the whole city, if I'm remembering correctly. Nobody else in Fairbanks. There were a lot of exposures, hospital and community.
Yeah. I worked up a measles exposure when I worked in Virginia. Well, I was slightly related to a measles exposure workup when I worked in Virginia, and that was a lot of work. So, yeah. All right. So, infection prevention in Alaska. You mentioned that you had some mentorship from your boss and from the infection preventionist who was retiring. How valuable is mentorship to a new infection preventionist?
I think it's crucial because when you walk in, there's so much. The job, no matter what size facility you're at, critical access, ambulatory surgery center, academic medical center, the job can vary so widely, and there's so many different things you kind of need to know and need to do. It can be hard to get to your desk and decide what you need to work on in that moment. So it was really good to just have such strong IPs who could show me the ropes, show me where to look for what was important, what was worth the time and effort, and just really get a good solid understanding of the basics. I also had the time to really dive into the basics. They would just say, something would be going on, and they say, okay, now read the APIC chapter on this topic. And so I had to learn a lot that way.
So they help protect your time so that you could learn. Right. That's good. That's excellent. That's excellent. I would envision a lot of IPs do not get that luxury. Like we get into the job and it's just, learn on your own time, right?
I had some heartburn over that as when I was training my own IPs later on in my career that in the middle of the pandemic, it was not as easy to protect people's time.
Yes, absolutely. Okay. Any fun stories from infection prevention in Alaska, apart from measles? I mean, Alaska is such a wild place.
I know, right? It is. I think probably the craziest to me was when the attached skilled nursing facility, long-term care facility, wanted to bring in a reindeer for the residents to brighten their mood around Christmas time, and just trying to figure out what we could realistically allow, how close it could get to the building or the residents and stuff. And that was something I never envisioned having to have a conversation about.
How did you guys resolve that? Like, what was the process that was approved at the end of the day?
Right. If the residents were well enough, they could go outside, lots of hand washing, and still get to enjoy the reindeer, but we couldn't have it inside or anything like that.
Okay. It wasn't going from door to door like
no.
Probably someone envisioned.
Yeah.
Wow.
Yeah, we couldn't allow that.
That's incredible. All right. So looking at your LinkedIn profile, you left Alaska and you have done a lot since then. You have a lot of titles and things that you're doing in your local APIC chapter. Can you talk us through some of what you've been up to?
Sure. When we moved back to the lower 48, I took a job at a level 1 trauma center, academic medical center, and really had my eyes open to just different challenges when you move to a much bigger facility, a children's hospital, all of the residents, all of them. I had a great team. And then around the time the pandemic started, we were down to 2 people and no director. So that caused a lot of challenges and growth there at the beginning of the pandemic. And by the summertime, my leadership had asked me to consider applying for the director role, which I did, got offered and accepted. So I got the chance to have that leadership role. I had responsibility for 5 infection preventionists there. And continue. I had got in with the local APIC in Alaska. It's a statewide, everything's statewide. So joined in with that group in Georgia as well, and got involved in the Georgia Infection Prevention Network and Project First Line stuff. So I've taken on some leadership roles in some of those different organizations.
That's wonderful. In any of this work, has your non-nursing background presented any kind of hindrance?
I will say sometimes in the role, especially if staff aren't used to encountering people who aren't nurses, there can be some pushback if you're trying to work with them on a process or change a process to be safer infection prevention wise. There's definitely sometimes some barriers there of them not wanting to listen or not understanding why you might be qualified. But I definitely feel like within APIC as a whole, they're moving, recognizing that a lot of different backgrounds make a good infection preventionist. I was fortunate in the area I was in. They were welcome anyone who wanted to be a part of APIC. They were so glad just to have these IP roles, being someone good and qualified and excited about it to be doing the job. And so you quickly can get asked to be a leader if you show interest, no matter what your background is.
good, qualified, and excited to be there. I think those are definitely good features. By qualified, are you talking about the CIC or something else?
Yeah, something acceptable in the role. I feel like other IPs, at least in my local APIC, they didn't really say, oh, it needs to be only nursing or it needs to be this. Like, as long as the hospital was willing to consider you. Yeah.
Okay, all right. So, as a director, did you have? Sounds like your system was okay with IPs from varying backgrounds, but while you were hiring, is that something that came up a lot? Someone being hired into IP, well, are they an RN or not?
Sometimes it can be hard, especially if like the last few hires were not RNs. I would hear some comments about, well, the next one should be an RN. It could also pose some interesting conversations around salary and, how do you decide how much to pay someone, maybe if they have 0 IP experience or maybe even a year IP experience with an MPH versus someone who's been in nursing 15 years but never really done any data, anything infection prevention related. I was always a strong proponent to what they could bring to the team, what we needed, and that value versus strictly looking at years in one field, or why would 10 years in public health not equate to the same thing as 10 years in nursing when you get into infection prevention.
Okay.
So
Okay. It's these conversations are always interesting because at the end of the day, your public health graduate is usually missing some kind of hospital experience, clinical management of patients and things like that. But they have a strong rooting in surveillance and data analysis, whereas your nurse has all of the clinical experience, but they are lacking in surveillance and data analysis, generally speaking. So, yeah, I think you say, what does each candidate bring to the table? I think that's critical. What does each candidate bring to the table, and what does the rest of the IP team need at the table, right? What advice would you give an aspiring IP? What would you tell young Carmen who is trying to become a big shot in adhesives and tell her there's a better way? What would you tell an aspiring infection preventionist?
Yeah, I think that kind of goes in well with what we were just talking about, of that healthcare experience being really vital. So I think the number one thing that comes to mind is whatever stage you're in, either volunteer at a hospital, doctor's office, health department, whatever type of opportunity you can get that gives you some healthcare experience, even if it's not specifically at in a hospital or in an infection prevention department, or get a job in that same type of environment, if that's where you are in your journey, or even doing like an internship with an infection prevention department, if whatever program you're in has some sort of internship. If you're already in healthcare, be the unit or department champion for infection prevention. Take that initiative to be seen as an IP. So when there is an opening, you can, fill that in, and people already are seeing you kind of fulfilling that type of role. And if you're still in school and don't have time to volunteer or have a job, utilize whatever school project you have, assignment you have, that you can study healthcare-associated infections or antibiotic resistance, just so you kind of are coming in with a base knowledge of some of what goes on in healthcare or within an infection prevention department.
Okay. All right. So familiarize yourself with the world that you're trying to get into.
Mm-hmm.
So we talked about mentorship. We've talked about internships. Have you ever had any experience with job shadowing, either shadowing someone or having someone shadow you? And do you think that's important in, people trying to become infection preventionists?
I think that can be really helpful, Ivan. I think I quickly learned when I was hiring, there's rarely experienced infection preventionists looking for a new job in the markets that I've been in. So whether you get someone completely new to the workforce or someone coming from another background, you're going to need to train them. There's a pretty steep learning curve in infection prevention, regardless of what background you're coming from. So to maximize the chances of someone staying, I really saw that people who had shadowed or interned within that type of department were much more likely to have longevity because they kind of came in with a better understanding of what the day-to-day would be versus someone who is just kind of jumping at something, a chance they saw. A lot of times they ended up it not being what they wanted or what they thought it would be. And so then they ended up going back to their prior type of position within a year or two.
Okay. Yes. Hospital infection prevention is not like Outbreak, the movie, right?
Yeah, it can be monotonous, kind of having to do the same thing over and over, have the same conversation over and over again. Sometimes it can feel like you're not accomplishing much.
Yes. How often can you tell people to wash their hands?
Oh, that is what my spouse tells people I do for a living. I'm like, oh, if only you knew. There's much more than that, but I can't say you're wrong. I do. That is part of it.
Yes. What are the strategies for IP success in your experience?
The first thing I would say is being relational and collaborative. In my opinion, that gets you much further than anything else in your day-to-day conversations. Going back to what we were just talking about with having to have similar conversations over and over again, the more relational you can be, the more people trust you and the more you can collaborate to really understand what the barriers are to whatever issue you're facing, whatever's not being cleaned or, a lot of devices being used, et cetera. I think that definitely makes you successful and part of the team, being seen as part of the healthcare team, and always being curious. So everyone in healthcare has specialized in something, specific. They have their own expertise, and there's probably a reason that they've skipped a step or bypassed something or are resistant to adding in this new step. So get to know people, get to know their process, their pain points, and then it's much easier to find common ground and keep the patient safe.
Okay. One of the things that the show is going to advocate for is we are not the hand washing police, right? I remember many times I would show up on a nursing unit and someone would say, "What have we done this time?" And for me, working as an IP, the more years I worked as an IP, the more that statement was slightly offensive, because that showed me that I was not rounding on a particular area enough. If I went to a department and someone said something like that, then that meant I was not present enough in that unit to just know people and be considered part of the team. So,
Mm-hmm.
yeah. What are your thoughts on IP turnover?
Well, IP turnover really can hinder the forward momentum and infection prevention program. For I feel like turnover is a culmination of all the things we've kind of mentioned here today already, but there's that steep learning curve. So there's a big time commitment to find an infection preventionist, to hire, train, and then they have to go in and build those relationships if they've not already been familiar with your particular facility. So you kind of need all that going on in order to really start to see success. So if you're in the middle of a new initiative or really trying to hone in on a problem and your IP leaves that, is big in that, you really can notice the gaps. Sometimes those things never get picked up again, or you kind of have to start from scratch. So it's definitely something I'm passionate about. I'm passionate about trying to reduce and think about different ways to reduce that. Some of us, when IPs come from other healthcare backgrounds, like lab or nursing or respiratory therapy, something like that, a lot of times they're really valued that shift work and maybe didn't realize how much they loved only having to work 3 or 4 days a week with long breaks in between. And then just overall, a lot of people rate flexibility high on their priority list for a job. So I think we definitely have to look at the work of an IP and find creative ways to allow for flexibility and possibly even remote work when possible, to continue to get those best candidates and retain them long term. I kind of already mentioned I think a lot of it comes from the job not actually being what they thought it was going to be. I think it's really important to be upfront in the interview about the job duties, and like we were saying, allowing shadowing whenever possible so that they can kind of see what a full day looks like before they decide for sure that's a job that they would be interested in. So I think in an ideal world, we would have kind of a pipeline of infection preventionists from people interning, shadowing, volunteering to pull from when those openings do come up. But, you have to allow them to come in order to do that. And it can be really resource intensive to do that, especially if you're offering like an internship or something, or even shadowing. You've got to have someone there for them to shadow, and or if they're going to follow along with you, make sure it's representative of the job and stuff. So
You have to do the work and also, help this person who is watching you do the work. Yeah. Now, turnover is very complicated. It's definitely something that the pandemic. Do you think the pandemic worsened turnover, or it just created a breaking point for something that was already in bad shape for IP?
Yeah, I think it kind of it made it hit a breaking point, similar to what we saw in a lot of other fields, especially with people that were able to retire, going ahead and doing that because of the stress and the health concerns and other things that went into those decisions. And then also we trained a lot of people under pandemic conditions. And so now that things are kind of rolling back to what it was prior to the pandemic, I think that's been eye-opening to some people who had not worked prior to the pandemic.
Okay. Where do you think we're headed? Especially just thinking about turnover and the relatively slow trickle of people coming into IP, the absence of a pipeline. place, as you mentioned. Where do you think the business is headed in the next decade?
Yeah, I think there's some bright spots on the horizon. I definitely am thankful for all that APIC's doing to think about this and work on this, between talking with universities about how to prepare students to be infection preventionists. And then there's a lot of push, at least in my spheres that I see in the social media realm, to not gatekeep so much, quit putting RN only on things, and just open it up to others who might have really relatable skills, something that can be easily transferred into infection preventionist, which we're seeing, I feel like, a lot more lab and MPH. It's been a little slower for some of the other related fields, but I think we're starting to get there, and people are seeing the value in hiring those staff as well. And then other work's being done on like career ladders. Sometimes people maybe feel like there's nowhere else to go once they've been in the field for a couple of years. So there's different work. I know some healthcare facilities or healthcare systems specifically are working within their own realm to see what they can do to, step people up as they progress in the field or have been in the field longer. And then APIC's worked on career ladders as well of other things you can go into, like research, or a lot of industry partners are also hiring infection preventionists onto their team to really put infection prevention earlier in the product process. So I think it's exciting. There are still opportunities. It's not all dim and bleak.
Okay. All right. Anything else that you want to talk about?
I think I would just encourage networking. I don't think that's anything I've really brought up yet. Just being involved when you can in either APIC or SHEA or whatever you might have locally, as far as a network of peers. It really makes the job easier when you can just call someone down the street that's doing something similar to what you're doing, and talk with them through an issue, or see how they're handling a particular problem. They offer a lot of good leadership opportunities or different things if you're looking to grow. A lot of times they'll have educations, they'll have yearly conferences, they'll have like board positions or other volunteer positions on any of those, IDSA, SHEA, ABIT, all of those. So, get out there and get plugged in would be my kind of last advice, I guess.
Absolutely. Well, Carmen, thank you very much for your time. We appreciate you being on the show and sharing your insights, collaboration, curiosity, networking. I think is one of the other things that you mentioned. So, what was it? Be good, be interested.
Yeah.
Be good and be interested, and just get in there, right?
Yeah.
Wonderful. Carmen Duke, thank you for your time, and this is it from the show.